Segment is sponsored by the University of Utah Health. Cancer can be a hard subject to talk about, but knowing the warning signs could save your life. Here to share some symptoms to look out for and more information is Dr. Hilary McCrary from University of Utah Health. Thank you so much for being here. We really appreciate it.
Yeah, thanks for having me.
Of course. Okay, I want to talk about a specific type of cancer that we are needing to be educated about today. So can you kind of tell us about that?
Yeah, so we're here to talk about oropharynx cancer. It's kind of one of the more common cancers that's on the rise in terms of head and neck cancer specifically. 70% of this type of cancer is caused by something called the human papillomavirus, HPV virus, commonly associated with cervical cancer in the past.
Okay.
So kind of important for everyone to realize that it's not only, cervical cancer that's caused by HPV, but also oropharynx cancer.
Sure, so important. Okay, well, let's talk about some of the signs and symptoms of this cancer.
Yeah, so one of the most common ways that this cancer can present, we commonly tell patients, we call it the shaver's cancer. So patients will be shaving their neck and notice a neck mass, and that's kind of one of the first things that they're going to notice. Patients can also have weight loss, difficulty swallowing, ear pain, fatigue, chills, things like that, but commonly it'll present with a neck mass.
Okay, wow, this is really powerful information because a lot of people might not be aware of these. So, and just common things that you're doing that really to keep a lookout for. What are some of the causes and risk factors? Let's elaborate more of this cancer.
Yeah, so really importantly, this type of cancer can be caused by, like I said, the HPV virus. That accounts for about 70% of these cancers. And then other causes are going to be, heavy tobacco use, smoking, and alcohol use. And then just general risk factor of prior head and neck cancer can also be a risk factor.
Okay. What are some of the treatment options? Let's talk about that.
Yeah. So I work at the Huntsman Cancer Hospital, and so one of the treatment options is potentially surgery. We use what's called the Da Vinci robot to take out these cancers in the back of the throat. So we use very specialized technology to go and resect those tumors if they're amenable to that. So that's particularly for very small tumors. If they're bigger or widely spread, then we can also offer chemoradiation for those types of cancers.
Okay, so there are different options that you guys offer. Yeah. Okay, how can the risks of getting this cancer be decreased?
Yeah, that's an excellent question. So the HPV vaccination is something that we want to promote. It is available to all adults up to 45 years of age and as young as 9 years of age for both men and women.
Oh, wow.
So just want to raise awareness that everyone should get their HPV vaccine and that it is available until the age of 45.
Great. Get the word out. Absolutely. So important. Okay, Dr. McCrary, where can we go for more information?
Yeah, so I would refer you to our website at the University of Utah and the Huntsman Cancer Institute. And we've got a great team up there that can answer all your questions.
Love it. Thank you so much for being on, and thank you for all that you're doing to both treat and spread awareness of this cancer.
Yeah, thank you.